Melbourne, Australia. And it's my pleasure to be here with you today. Rest assured though, Safia will be back in the chair next month and will be leading these monthly thereafter. Today's webinar is focused on program registries. Digitising program registries is a growing need across the Pacific, and we're seeing an increasing number of requests for them from many countries. Program registries can very quickly exacerbate problems with digital health, however, and if they're not carefully managed, can quickly become unsustainable or an unhelpful burden on frontline staff. Today's webinar will showcase Tamanu's program registry module and demonstrate our philosophy of handling all registries within the one software system, which can also be used as your electronic medical record or EMR. This allows longitudinal holistic care of patients, reduces the proliferation of software, and reduces costs and the burden on health IT staff. Today, we'll be presenting on 3 existing case studies of program registries using the Tamanu module. But there are others as well, including the upcoming National Notifiable Disease Surveillance System in Fiji. And if anyone has any follow-up questions or would like further information, please don't hesitate to get in touch. So the agenda for today, I'm going to give a bit of a background to program registries first, so what the problems are and what we think can be done to overcome that. We'll have an introduction to Tamanu's program registries module from one of our project managers, Shakti Gaunda. And then we'll hear 3 case studies of how Tamanu's program registries module is being used across the region. So we have Dr. Thomas Russell presenting on the use of the module for the hepatitis B clinic in Kiribati. Amanda Lipinski, BES project manager, talking about the use of the module for overseas medical referrals in Nauru. And Tim Drown, another BES project manager, who will be taking us through the use of the module for NCD screening in Samoa. And before we move on, I just also want to say a big thank you to DFAT for supporting this series, and welcome to all DFAT staff from the Global Health Division and DFAT posts who are joining us here today. So let's get into it. So what is the problem that we're trying to resolve? So we know that ensuring continuity of care between all levels of the health system is essential to clinical outcomes for patients. So all the way from community care up to primary, secondary and tertiary care, and having a linkage between those. Program registries provide the ability to track cohorts of patients. So for example, patients who are at high risk of NCDs, patients diagnosed with certain types of cancer, things like hepatitis B, etc. So there's a real clinical benefit there in being able to track those cohorts of patients. There's also a benefit, an administrative benefit to health workers who need to be able to keep track of these patient cohorts as well, and being able to reliably follow up patient progress obviously also has clinical benefits. We also know that clinicians and nurses in our region wear a lot of clinical hats, so managing patients with multiple clinical conditions. So it's not really sustainable to be able to, for those nurses and other clinicians to be opening up a different app each time they need to manage a patient with a different clinical condition. We are seeing the proliferation of highly specific software for specific clinical use cases. And when you've got that circumstance where nurses and clinicians need to be managing patients with different clinical conditions, having to switch between them really isn't sustainable long term. In addition, there's also concern about maintenance. So we know that health IT departments in our region are also very thinly stretched. So every time we introduce a new application for a different clinical use case, there's that added burden there to be able to manage those systems long term. Integrations are often sort of touted as a bit of a solution to this. And in some cases, obviously, they are important, but they're also quite expensive to implement and also to maintain. So it's not just a one-off piece of work that happens with an integration. It's something that needs to be maintained long term, and obviously resources need to be put into that. So how do we think this can be improved and what could work? So we believe that the solution needs to be able to work across both desktop and mobile to enable it to be used across all different settings. So, for example, mobile would be more suitable for use in community settings. And then when you're dealing with something like a tertiary care setting, desktop solutions would be more appropriate to be able to handle those more complex scenarios. It also needs to be able to work offline, to be able to work in remote locations, and so as not to interrupt workflow for clinicians where internet may be patchy. And it should also be free and open source so that people are not locked into expensive long-term ongoing license fees. The system also needs to be able to be locally maintained. So where there's a need to introduce a new registry for a different clinical use case, that should be able to be added into an existing system rather than introducing a completely new and siloed digital program registry system. Next, we say this a lot at BES, but perfection is the enemy of good. So we believe that if the same system can meet 90% of your functional requirements, that should be the preferred option rather than introducing a new application for a specific clinical use case and sort of siloing it out from the core system. If we can do that and use the existing solution, this is going to be more sustainable in the long term. And the last point there is an ethical question in regards to the introduction of apps for research projects that are used to harvest data for the purpose of research, but could never really feasibly operate as a long-term program registry or electronic medical record. So again, in that case, the preference should be, wherever possible, to use or extend upon existing clinical systems. Okay, so let's hear from our first speaker, which is Shakti Gaunda. So Shakti is a project manager at BES. He previously worked as a surveillance officer for SPC and before that for the World Health Organization. He's worked extensively across the Pacific and currently supports our projects in Kiribati and Fiji. And he'll be giving us an overview of Tamanu's program registries module. So over to you, Shakti.
Thank you, Emily, and good morning, everyone. I'm sure a lot of you who have worked in clinical and public health settings have come across program registries, especially those who have worked in vertical programs such as the TB program, or those who have worked in disease-specific programs such as the cancer program, have all seen a registry. So today what I'll do is I'll give an introduction of those registries in Tamanu 2.0. In today's session, I'll give a brief overview of what the program registry module is and how it is being used. And then I'll go into more details of some of the features available in a desktop and mobile. So in desktop, I will cover three main features, which is the patient level registry component, the dashboard, and then the patient listing. And then I'll briefly touch on a mobile. And at the end, I'll explain very shortly on how we can set up a program registry on Tamanu. Next, please. So the program registry module was actually initiated and implemented in March this year, and it's available in both desktop and mobile versions of Tamanu 2.0. So what this module actually enables healthcare workers to do is to monitor or track any patient cohort or patient population that's defined by a particular disease or condition, for example, TB or cancer, and then follow this patient or population over time. Healthcare workers can also view the patient dashboards for a summary of care. It enables users to easily track patients for follow-up, for the facilitation of quality care or patient management, promote uniform data entry and collection, and allow the measurement of patient outcomes under certain treatments. So the model is quite easy to use. It's very user-friendly, and the workflow enables you to add and remove patients from a registry as needed, maintain a conditions list for registered patients, and assign a clinical status to each patient, and then track a history of the statuses that you have assigned. Thank you. Next, please. So just jumping on to Tamanu desktop. In desktop, we have a patient level program registry component. So at the patient page that's highlighted in red there, you are able to add a patient to a program registry and then view current and historical program registrations. Next, please. And then next, thanks. So once you add a patient to a program registry, you can record the clinical status of the patient, the date of registration, the clinician, the facility, and the conditions that are relevant to the patient registration. Next, please. The second component of desktop is the dashboard. So from the program registry component that I just mentioned previously, users can access the dashboard. And the dashboard will provide an overview of the patient's history under a particular program. I'm not sure if you can see the image very clearly, but it's showing the dashboard under a cancer registry. And in the dashboard, users are able to view a history of assigned statuses. So it's highlighted in orange and blue there, showing active treatment and awaiting treatment, for example. And on the right side, we have related conditions or program-specific conditions list. And then at the bottom right, you can view previous responses to program forms. In this particular case, we have a cancer registration form that was filled on 11th of April, 2024. So also in this dashboard, users are able to change the clinical status of a patient, maintain the conditions list, complete a program form that's relevant to your particular program, and then remove or delete a patient from the registry as per your protocol. Next, please. And this is the third feature of desktop, and probably one of the most interesting and important ones is the patient listing. So the patient listing supports easy tracking of all patients registered to a program. So in this particular image, we have the cancer registry, and you can see the cancer cohort all in one particular place. And in this particular page, you are able to search for a patient. You are able to view the current patient location, the current clinical status, and you are able to change the clinical status, view patient conditions, and also remove or delete a patient from the registry. Next, please. So that was desktop. So in summary, we have the program registry component at patient level. We have the dashboard, and then we have the patient listing. So the program registry functions are also available on your mobile or your tablet. And in the patient's page on the mobile, you can add a patient to a program registry. You can view and update registry details for each patient, and you can search for all patients in a particular registry. So let's say if you're aware that a patient has a tuberculosis, you can specifically search for that patient in the TB registry and use filters such as age, sex, village, or date of birth. And similar to desktop, you are able to complete program forms. And once synced, this can be viewed on desktop as well. Next, please. This is the last slide. In terms of setting up a new program registry, this is quite easily done by importing an Excel sheet into Tamanu. In that Excel sheet, we'll have the contents that you need in the registry and any associated forms, and then we import that into Tamanu. Similarly, we are able to import certain permissions using Excel sheet into Tamanu, and that permission allows accessing different parts of the program registry for filling forms and reporting. So what this means, for example, we can limit changing the clinical status to doctors only and so forth. So it's quite easy to import the Excel into Tamanu and set up a program registry. It's a little complicated to fill in the contents of the Excel, but however, through training, this is very possible for users to do that, especially because you don't require any coding skills or any knowledge of data language. And once we have trained on how to set them up, users can build and import as many registries as they need. And of course, BES is always here to support them whenever needed. So that was a brief introduction to program registries. In summary, it's available and applicable to both desktop and mobile, and it enables healthcare workers to track and monitor cohort of patients with a particular condition or disease over time. And lastly, it's quite easy to set up a program registry simply by importing an Excel sheet. Thank you.
Wonderful. Thank you, Shakti. So we are now going to launch into seeing how this is actually being applied in practice across three different case studies. And so the first is a video presentation. Sorry, just a moment. The first is a video presentation, and it's from Dr. Thomas Russell, who's an internal medicine specialist who has been working for the Ministry of Health in Kiribati and hepatitis B-free Sydney. He specialises in hepatitis and is currently assisting the hepatitis program in Kiribati in both clinical and public health work. He's based in New Caledonia and conducts telehealth with hepatitis patients in Kiribati and also regularly travels to Kiribati to conduct clinical and public health work. So we have a video now that will be shared.
Good morning, everyone. My name is Dr. Thomas Russell. I'm very thankful to the team for inviting me to share with you a short presentation on the use of Tamanu's program registry and how it's being used by the National Hepatitis Program in my island home of Kiribati. Special thanks to Shakti for helping prepare these slides for today's presentation. So this is an overview of what we'll be covering in the next 15 minutes or so, or maybe less. I'll share a snippet of the viral hepatitis situation in Kiribati. Then we'll jump into describing and discussing how the Tamanu's platform is used and how one might navigate its features. So on the 13th of March of 2024, the program went live for the hepatitis program at the main hospital on South Tarawa. Now, hepatitis B is quite unique for the country of Kiribati, especially the burden of both hepatitis B and D. The prevalence rates are one of the highest in the world for both these conditions, and co-infection with hepatitis D for a patient with hepatitis B leads to a worse disease outcome. Treatment is available in Kiribati for hepatitis B only, and despite the significant number of tests that have been conducted over the years and the positive patients that have been detected, attending clinic and adherence to treatment is a significant challenge. Now this slide depicts the sequence of events that a user will take when using Tamanu. There will be a video presentation at the end of it that shows this workflow. Essentially, a user will log in, search for a patient's name or create one if it doesn't exist, complete the patient's demographics and essential details. Then you would admit or check in the patient to the concerned clinic, in this case, the hepatitis clinic. Then we select the hepatitis forms that is relevant for the visit. It could be a lab form, it could be a screening form. And then finally, the patient is registered. Once all these forms have been filled, we're at the within the hepatitis registry. As far as the hepatitis registry is concerned, this week we've managed to register our 400th patient, with many more to be registered in the coming weeks, particularly cases and data that are coming from the outer islands of Kiribati. As you see in the screenshot here, with a single page, you'll be able to visualize your patient's primary details, which health facility they were registered at, their village or current location, and importantly, their clinical status and whether they're on treatment, whether they've yet to be evaluated, whether they require review, and so forth. As I understand from Shakti, soon we'll be able to utilize another program that they have at BES called Tupaya that will provide a visual dashboard of this data that gets populated into the hepatitis registry, or any registry for that matter. And I think that's when the fun really starts. Now here's a video that's been prepared to show how you navigate your way through Tamanu, and so I'll let it play and I'll just provide some voiceover. And so as you see, this is, as you open it, you've signed in. This is a patient being found, Taylor Smith. You admit or check in the patient to the department of concern, in this case the Hope Clinic, which is the hepatitis clinic. The clinician's name, my name is put there, what area I'm seeing the patient at, so that's the clinic, and then whether they were referred from an outer island or not. The patient citizen is a citizen, so, and then what's the reason for the encounter? In this case, it's a screening encounter. And then I enter that, confirm that, then I view the patient's encounter, which is there. You click on that, and then you find the forms. There's multiple ways of finding your forms. This is one of them, which is quite user-friendly in that regard. You select the program, and then the forms come out. Then you select the screening form, and so you just follow the prompts and what the fields need to be filled out, and several of them have a drop-down menu of choices, and some of them are free text. These are all by design, and so for users or programs that want to design their patient registry, your program registry, you can always work with the team at BES and see what's the best way of capturing the data that you find or you think is most essential to your work. And so I'll just give it a pause. And as you see, the patient has been registered, and the patient now, a single form has been filled. And you see there the program, hepatitis B program, and what survey form was filled. It was a screening form, and the date. And so you can click on it again and just see what you've populated. Once you've saved this form, you can't edit it, and so that's an important feature to bear in mind as you're populating the fields, making sure that you're populating with the right information. And this is now the same patient, Taylor Smith, being registered to the program. And so you click to the left-hand side where this program registry, and then program drops down, and then this small inbox shows up. And just pause it here, and so you have program registry over there, the name of the program, the ad registered by who, so this would be where the clinician's name would be, or the healthcare worker. The registering facility is the main hospital, but it can be an outer island health center or health facility. The status, are they on treatment? Do they need to be reviewed? Are they lost to follow-up? Has treatment been stopped? There's several ways, and this again is something that is designed by those who need a program registry, and you work with the team to determine what classifications you want to put. And then the related conditions. So this is a classification of what the case is and what the patient has. So in our case, you either have acute hepatitis B, chronic hepatitis B with delta, or chronic hepatitis B with delta agent unknown, simply because maybe we have not tested yet. So I'll let it play. You save it, confirm everything, and then you see down here where the cursor is. That's where It confirms what you've entered and tells you that the patient is in the hepatitis B registry, and that is the current status. Just a quick visual that the patient is on treatment, or patient treatment has been initiated at this encounter. Then you go to hepatitis, the program registry, you select the relevant program. There might be several, depending on how many other programs are using Tamanu. And then this is specific to the hepatitis registry. You've got patient details there. You've got the national hospital number, which is automatically generated by Tamanu. This might not match the national hospital number for the country, but it's something that Tamanu allows you to create, and if need be, it allows you to search more quickly. First name, last name, date of birth, gender, home village. If that's populated, that will show up. Some of these are not, so that's why they're left blank. You can always click on them and go to the patient's details to effectively edit it. The registering facility, so it tells you where the patient was seen, at least. It might not tell you where they live or if there's a lot of migration within the country, but at least it tells you that the patient was seen there, and the notes or the folder might be located there for more details. Then that's not populated, so it's left blank. Related conditions, as we saw in the as you register the patient in the program, this is the different types of classifications or clinical classifications the patient might have. Acute hepatitis, and these can be very helpful in knowing as a clinician, what you like to plan. Whether it's acute hepatitis B, so that means not requiring treatment, but requires another review, perhaps in 6 months, making sure that you've got a scheduling on date, and perhaps some contacts on the patient's details to follow up and give a call and ask how they are and if they can come through. And then you've got the status, which is color-coded, which is very nice. It just gives you a good quick glance, an idea of your patient status. Are they on treatment? Are they not on treatment? Do they need to be followed up? Do they need to be reviewed? And so forth. And you can always search for a specific patient in the search bar menu. So first name or last name, you can find. And then if the information, the details have been correctly entered, you will be able to find the patient that you're looking for. And so there's Taylor Smith, one that we had populated the information for. So all her information is there, and if you want to change the status for perhaps she came up for review another time, and so you switch it to treatment ongoing, and so you had initiated on a certain date, and perhaps you see them 6 months down the line, you see they're currently adhering to their medications, and so you would highlight it. And then if you had a change in the status because you've done further tests and you found that now the patient also is co-infected with hepatitis D, then you can also change the status there on the right hand side. And then there are drop forms of all the different forms within this program, so it's more specific to what this patient is attending clinic for, this hepatitis patient. And then you've got colors on the side, on the left hand side with the green, those who have been registered. And that's essentially it. And so, thank you. I think that is a very quick, brief introduction or sharing of how we are utilizing Tamanu. We find it quite useful considering the paper base that we were usually using in the past, and the many issues that come with paper base, particularly missing folders, missing information, incomplete data, incomplete data entry, and it's been quite a revelation having Tamanu around. And now that we have its mobile capability and offline feature, we'll be looking forward to utilizing it when we go to another island later this month to do an outreach for hepatitis and see patients there, and then see how it works on the device and synchronizing it once the internet is there's internet connectivity, and seeing how it works. So we're looking forward to that, and perhaps we'll have an update and a chance to update on that. For now, thank you so much for listening.
Wonderful. Thank you, Dr. Russell. So just give me a moment while I reshare my screen here. And we're going to move on to our next case study. which is from Nauru. And hopefully you can see that now. So we're going to hear now from Amanda Lipinski, who's a BES project manager based in Nauru. Amanda's previously worked as a public health officer for the New Zealand Ministry of Health and for the Northern Territory Government. She's currently based in Nauru and has prepared this presentation with the overseas medical referral team there. So over to you, Amanda.
Thanks, Emily. So I'll just give a brief introduction to how it used to work here and how it's working now with the OMR registry, and then also a demo of how it works. So what was the previous process? So the doctors here type a referral letter that is then sent to the team at OMR. So that's either hand delivered or emailed. That is then saved into a folder on the desktop, and then the approval process to whether they can or can't go overseas is done off Tamanu, generally on an Excel spreadsheet, what remains only visible to the OMR team. So the referring clinicians cannot see what's the status, if they've been approved or where they're heading. So nothing is captured on the Tamanu that's visible currently to the clinicians. Once the patients returned from travel and discharged from OMR, there was no notes inputted on Tamanu as to what happened when the patient was overseas. Again, this was held on an Excel spreadsheet that's separate to Tamanu. Once the patient returned from overseas, generally they like to have a follow-up appointment here at RON. This was done by calling up the appointments team and making an appointment on Tamanu. So next slide, please, Sam. So how does the OMR program registry work in Nauru? So it's slightly different to the other registries in that it's administered by administration staff rather than clinicians. So the OMR team basically will organise flights, visas, etc., all the administrative process behind the OMR. The only role of the clinicians is the referral to OMR. So the permissions are locked down, so only the OMR team can add patients to the register, but viewing permissions are given to the doctors. That's just to keep it all neat and tidy so we don't get random people added to the register. It shows the whole patient journey, so from the point of the doctor's request to the point of them returning from overseas and everything in between, what happened while they're overseas and their status. It groups all OMR patients together in a distinct group on Tamanu, as you've seen with the previous demonstration. Clinicians can now see where their patients are, what hospital, what they're getting treatment for, and what step they are in their treatment. But we've removed the need for the separate Excel spreadsheet, so all information and updates now contained in Tamanu. With this new process, the OMR team can easily now book appointments using Tamanu appointment module, as a calendar is now fully visible to them. Next slide, please. So I've tried to keep it pretty simple for the OMR team. We haven't got too many different statuses, but you can see here, these are the ones we've used. So it's basically requesting to go overseas, been approved, ready for travel. You can see in transit, follow up, and overseas, inpatient, outpatient, and then return. So it's pretty self-explanatory on those statuses. So yeah, next one. When we're adding them to the register, the OMR team will always have contained in the referral letter what's the reason for going overseas. So we've got a few options here, and these can be and have been added to as we go. Anything's missing, so it's easily configured to add reasons why people go overseas. Yeah, next slide. So within the register, we've got 4 forms that the OMR team complete. And again, they're the only ones that complete these forms rather than the doctors. So the doctors just have to do the letter that they send to the OMR team. So the initial request form is a summary of that form, basically, why are they going overseas? Ready for travel, that's when they're ready to go overseas and we know exactly where they're going, what hospital, for how long. Update of progress is as the team receive any updates from the hospitals, they put it into Tamanu so the referring clinicians can see where they're at. And the final summary is upon return, what happened while they're away and what's to happen when they return. I think that's it for me. So yeah, we'll roll into the video demonstration. Thanks, Em. Welcome to the demo of the Nauru OMR Program Registry. So first, when a patient wants to go on an OMR, they need a referral letter from the doctor. So this is normally typed up by the doctor and either emailed to OMR or hand delivered. Once the OMR team have approval for the patient to go overseas for treatment, they then add them to the OMR Program Registry. So we're going to imagine that for this instance, Kalini Akua is our patient that we want to go overseas. So we've got approval for her to go overseas, so the OMR team would go into here and search for her name. So we've got Kalini Akua here, so we click her name and we just want to confirm that the details match what is on the referral letter from the doctors. Okay, so once we're happy with that, we hit add down here and we go overseas medical referrals, the date that we're putting her on the register, who it's by, so that's myself, the hospital, which is correct, and the status, so they've been approved, okay? So we've got all approvals ready to go, and then we add them to the register. Then we look at the conditions. Why are they going overseas? For this case, we're going to say that it's for cancer treatment, so we go oncology. Okay, we hit submit. We can see here that Kalini has now been approved for OMR and is sitting on the register by looking down here. To view her on the register, we click OMR Medical Referrals under the Program Registry title over here. So we go down here until we find Kalini Akua. We can also use the boxes up here to search for her name. So we would type Kalini Akua here, and that would also bring her up. We can easily see her here, and we've got a whole lot of other people here ready to go on OMR in varying different statuses. So we'll go through the statuses later on. So we click on Kalini. We can see here she's approved for OMR. So the first thing I need to do is summarize the information that is on the referral form from the doctor. So initial request form is the first thing we need to fill out. So we hit begin form. We put the date of the referral from the doctor, so say it was last week, estimated months away, we might put 4, and doctor, just say Dr. Bob, the reason that they're going, we can say it's liver cancer, okay, and any other conditions. So we hit next and complete. And you can see that survey is displayed down here. Once we know where the patient is going, what hospital and when, we need to change the status here to be ready for travel, okay? Ready for travel, we go confirm, and we also need to complete the form ready for travel. Now this details where the patient is going and for what treatment and for how long. So we go begin, so we got the date, let's just say they're going 2 weeks time. Is there any family going with them? Say their mum, and we've got Dr. Smith also going. In this case, we're going to say they're going to Fiji, the specialist, and we're going to say go away for 3 months. 3 months in total, approximately. Okay, and we go next. Complete. So you can see here they're now ready for travel, and we've got our 2 forms completed. Once the patient is in at the hospital, and we might be starting to receive some updates. So say they've had their first chemotherapy treatment, we might want to put that into the patient notes. So all doctors and other staff at Nauru can see that. So update of progress is another form we might use. So we go begin form, today's date, reason for update, we put treatment, and then the reason might be cancer treatment given. For example, just go next and confirm. Okay, so you can see here we've got all our forms here that I've completed. We also need to change the status of where the patient is. So they would do this at the same time as completing the second form. So we would put down here inpatient, confirm in Fiji. So we can clearly see from our status that we've got the inpatient in Fiji, okay? Once the patient is ready to come back from Fiji and back to Nauru, we need to complete the final summary. So this is generally once they're back in country, or we've got confirmation that they're coming back and the treatment is completed. So we go begin form, and we just put date of coming back and recovering at home, whatever status we've got here, any final summary notes. And we hit next and complete. We'd also need to change the status. So there's a number of statuses that might be working here. So if we go down, we can see that we've got return. So that's a return to Nauru, and they're no follow-up or no treatment, further treatment is required. And then at that point, we would remove them from the register. If we follow up at the hospital and they return, we would click the status, follow up at RON, and that's when they're waiting to be seen by a doctor in Nauru. And this one here is when they might need to go back overseas for treatment. So we'd leave them on the register and awaiting review. So in this case, we're going to pretend that this patient needs some follow-up at RON. So we'd go follow up at RON and leave them at that status. So we can see these patients are waiting to be seen by doctors here in Nauru. If they were to be removed from the register and they were returned, you can just click these buttons here and remove. The last thing I'll show you is just how we add documents to the patient's file. So we click on the patient's name and documents and add documents. So what they add here is the referral letter from the doctor and also any discharge notes from the treating hospital. So we'd upload that so everyone's got visibility of where that's at. Selecting the file and hit add, and that would sit under the patient's file there. So you can see here we can go back into the register and just quickly see where all statuses are that the patients are at. So that's the OMR register in summary of how it works. So thank you for listening.
Great, thank you, Amanda. So we are going to move on to our last case study. So just again, give me a second while I reshare. And in the meantime, if you have any questions that you'd like to ask, please just pop them in the chat and we can answer them there. So I'm going to hand over now to Tim Drown, who's a registered nurse who also works as a project manager for BES. Tim has previously worked in tertiary and emergency care settings in New Zealand and has been based in Samoa for the last 2 years, working with the Ministry of Health on the digitisation of their healthcare system. So over to you, Tim.
Hi, everyone. As Emily mentioned, my name's Tim, and I've been the project manager implementing Tamanu in Samoa for the last couple of years. Today, we're going to be going through another way to use program registries, specifically a diabetes and hypertension registry. So what are we addressing? There have been a number of studies that highlight the current situation with NCDs in Samoa, and more recently, in a 2021 study, it was found that 19.5% of participants had diabetes, 47.6% presented with pre-diabetes or diabetes, 31% had hypertension, and nearly 90% were overweight or obese. Among those with diabetes, only 20% were aware of their condition, and only 11% of those with hypertension were aware of their condition. Only 0.8% of all participants with diabetes had achieved glycemic control, and only 2.8% of those with hypertension had achieved control. To address this, the Ministry of Health's NCD program aims to improve awareness, screening, referral, diagnosis, treatment, and management of patients with NCDs, and more specifically, diabetes and hypertension. Next slide, please. And so what are we fixing, or what is the process or system that we are replacing involve? So at rural facilities in particular, they have an NCD register, which is in the form of a book. Patients' names and diagnoses are listed in the register, organized by village. Patients' folders were often stored in designated NCD cabinets, and the register was not often referenced or updated, making it difficult to identify patients and the current state of their condition. Next slide, please. And so if we take a look at how we've configured the registry, the diabetes and hypertension registry here in Samoa, the registry will only include those that have been diagnosed with diabetes or hypertension at this stage. This is because there are well-established protocols in place with already defined patient statuses that could be used to configure the registry. So as listed there, we have 3 statuses for patients: those that require follow-up, and these are patients who need to schedule or attend follow-up appointments for ongoing evaluation and management. These patients have not had an encounter with vitals recorded within the past 3 months. Patients that are actively managed, these patients are currently receiving treatment and whose condition is being actively monitored. For hypertension, these patients have had a blood pressure reading within the last 3 months, but the reading remains too high. And for diabetes, patients have had a blood pressure and a fasting blood sugar recorded within the last 3 months, but these readings remain too high. And lastly, under control. And so these patients who their condition is stable and well managed according to the NCD protocol. And for hypertension, this means a patient has had a blood pressure reading under 140/90 within the past 3 months. And for diabetes, a patient has had a blood pressure reading under 130/80 and a fasting blood sugar reading under 7.0 within the past 3 months. And so, like I previously mentioned, these definitions have been defined by the Ministry of Health's NCD program. And the following video will go through the process a patient may go through, leading to them being added to this registry.
Okay, we're going to go to the video demonstration now.
If we have a look here at our patient Stephen Adams and we navigate to programs and start the village screening form, this is a screening form that's been developed for the Ministry of Health that will screen patients aged 18 and above, and it's incorporated 2 separate screening tools, one for those aged 18 to 39 and another for those aged 40 to 80. Now, in the interests of time, I'm going to race through this form and answer mostly just the mandatory questions. The Ministry have identified some major risk factors, and so some of these questions here are components of that screening form and make up the calculation of how many major risk factors a patient has. We can see that in the form that we can incorporate calculations and validation criteria, including making questions mandatory to minimize manual errors that are made when completing screening forms. So we can see this individual has 5 major risk factors using the 18 to 39-year-old risk screening tool. That puts Stephen Adams into a very high risk category using this tool, and we can also see that this individual has heart disease warning signs, stroke warning signs, a high average systolic blood pressure, and a high average diastolic blood pressure. So this person should be referred to the facility, so we'll click yes, and we'll refer him for the reasons that have been highlighted above. The result of that form is very high risk. So if we now navigate to Tamanu desktop and we find our test patient Stephen Adams and we enter his record, if we go to forms, we can see that the screening form that has been entered on Tamanu mobile has synced across to Tamanu desktop, and we can see that result of very high risk. If we click on that form, we can also see the responses that were entered. So we're going to check in Stephen Adams to our clinic today. And so he'll be presenting to general outpatients. So if we go inside that encounter that we've started at general outpatients, we can record some vitals for him. So we'll record a high blood pressure, which is the same findings from the screening form. And so in that case, it may be relevant to diagnose Stephen with hypertension. So after we make this diagnosis, we should add Stephen to our program registry. And we do so by clicking the Add button, and we can see that some of these fields are automatically completed based on the user that's logged in and the registering facility. And based on the statuses that have been determined by the Ministry of Health, we know that Stephen's blood pressure is still too high, but he has presented to the facility recently, and so he's therefore actively managed. And for his related conditions, we've just diagnosed him with hypertension, and so we will add that as his related condition. After doing that, we can press submit, and we can see on the left-hand side that Stephen has been added to the diabetes and hypertension registry, and that his current status is actively managed. If we click on that and we go to his registry homepage in his patient record, we can see all of the details that have been entered, and we can see below the screening form that was entered on Tamanu Mobile earlier. And that's because we can associate forms and programs with a registry to easily view a patient's journey within a program. If we navigate now to this Excel report which I generated earlier, we can see that this report has pulled out patients that have already been added to the registry. And on the left-hand side, we can see these patients' demographics and personal details. And on the right-hand side, we can see what related conditions they have. And then beyond that, we can also see the date of their most recent visit and their blood pressure, both systolic and diastolic, and fasting and random blood sugar readings from that visit. And based on these readings, we've added some rules to the back end of this report, which we can then define the clinical status of these patients. So this will be a really useful tool for clinicians and users of the registry out at facilities, where we can easily see the key details that define a patient's status on the registry, and even add in some decision support to help make that process easier for them.
Great. Thank you so much, Tim. So that brings us to the conclusion of this webinar. So hopefully everyone found that interesting. Yeah, I particularly enjoyed the case studies. It's always nice to see how these things are actually being implemented in practice. Thanks also for the questions. I think most of those have been answered now. There's a couple of last minute ones there. So our BS team in the Melbourne office will answer those. So I'll keep the call going for a couple of more minutes so that we can answer those. While we've still got the call going, we do have the next webinar on August the 8th. So if you haven't already, sign up to our newsletter through our website, so bes.au, and then you'll get a newsletter that tells you when the next webinar is and how to sign up for that. And then, of course, when you sign up, you will need to register so you can join just like you have today. Thank you, everyone. And like I said, I'll just leave this on for a couple of minutes to respond to the questions, but otherwise this webinar is closed, and thank you. We'll see you next time.